So this is about the peripheral vascular system and the lymphatic system. I have omitted a lot of information because it's very similar to the cardiovascular system. So I'm trying to only focus on the differences. With the vascular system, we have the purpose, which is to transport blood and lymph fluid. We have our arteries that carry the blood from the heart, which are strong and tough and made of elastic fibers that allow for stretch with systole and recoil with diastole. And then we have our veins, which drain deoxygenated blood and waste from the tissue and return the blood to the heart. The veins are more thin as well as more passive than your arteries, and they contain valves that close during flow of the heart. So the way the vascular system gets blood back to our heart, because it has to fight gravity to do this, one way is by milking of the skeletal muscles. So every time your heart contracts, it milks the blood so that it can get back to your heart. We also have one directional flow because of the valves in our veins, so that blood won't go back down with the fighting of gravity when the heart is not beating. And then we have change in pressure gradients from breathing. They help reduce stress on the heart because veins are able to stretch and they hold more blood. So because of the fact that we're fighting gravity all the time, some risk factors for venous stasis are standing and sitting as opposed to moving. By moving, we are helping our blood circulate, and when we stand, when we sit, when we're on bed rest, our blood begins to pool and becomes a risk factor for venous stasis. Another big risk factor is if blood is hypercoagulable. So like polycythemia vera makes your blood hypercoagulable. Smoking makes your blood hypercoagulable. So risk factors there. Having varicose veins, obesity, being pregnant, because you have more abdominal weight and that causes the blood to not work as well. And genetics can play a role too. It's not a big role though. So our lymphatic system, what it does is it helps to retrieve any excess fluid and plasma proteins from the interstitial and returns it into the bloodstream. So it has three major functions. We have movement of lymph fluid in relation with the cardiovascular system. Then we also, with the lymphatic system, develop and protect the body against disease. And then it also reabsorbs lipids from our small intestines. And organs which help the lymphatic system are our spleen, tonsils, and our thymus organ. Our subjective data would be if the patient has any abdominal pain, flank pain, or back pain, arm or leg pain, if they are having signs of intermittent claudication, which would be exercise-induced pain in the legs, if they have hair loss in their lower extremities, or cold, numbness, or pallor of the lower extremities. Any skin changes that were noted on the arms or legs. Any swelling or lymph node enlargement or tenderness. Certain medications can make us more prone, and then if they have a smoking history. So with our health history, we're going to ask specific questions regarding abdominal, flank, or back pain, as this can be indicative of a AAA. Going to ask questions regarding any arm or leg pain, if they have any fatigue. This can be indicative of Raynaud's, peripheral arterial disease, or acute or chronic limb ischemia, both of which can be concerning. Questions concerning coldness, numbness, or pallor. Again, that will give us a clue as to whether or not there's acute limb ischemia, chronic limb ischemia, or some peripheral arterial disease going on. And then questions regarding poor wound healing or pain with walking, which is peripheral arterial disease. We also want to identify any risk factors such as tobacco abuse, elevated cholesterol, high blood pressure, coronary artery disease, or diabetes, and then a family history of the same. So our objective data, we are going to inspect, palpate, and auscultate. We want to assess our arms and legs. We're going to assess for color, temperature, texture, and tartar. note if there's any edema in our extremities. Why are we noting if there's any edema? Because if the blood is pooling or if our lymph is not returning to where it should be, then everything's going to be edematous. We want to look at clubbing of our nail beds because that means that we're not getting enough oxygen to our tissues. We're going to look at our capillary refill. We're also going to assess the pulses that we assessed with cardiovascular, but we also want to look at specific arteries such as your abdominal or aorta, your renal artery, and your iliac artery. And then those are the references.